Welcome to the Holistic Psychiatry Podcast. I'm Courtney Brown Snyder, a physician and holistic adult and child psychiatrist. In this episode, I'll be talking about children and how specific root causes can manifest in children, what symptoms and traits they'll show. For example, tantrums, shyness, oppositional behavior, severe carb craving, perfectionism, tics, compulsions, and drunken-like behavior can each point to specific imbalances. Because children's brains and bodies are still developing, and because they don't have the same degree of hormonal influences, some of their symptoms and associated psychiatric diagnoses will differ from adults with the same imbalances. As you'll see, inattention and hyperactivity and the diagnosis of ADHD can be a manifestation of multiple root causes, so that in of itself doesn't point to a specific root cause, but other traits that can be co-occurring with it can. Though I'll discuss the common imbalances separately, more than one of these can be present, and usually more than one is present. Teenagers' symptoms tend to resemble those of adults, so that won't be the focus here. And each of these topics that I'll comment on briefly, I've done a podcast on previously, and we will include the links to those in the description. So starting with undermethylation, and this is to remind you, a biochemical imbalance that impacts our ability to detoxify, our ability to break down histamine. To remind you, undermethylation is a biochemical imbalance, and it is something methylation happens at a cellular level and has many functions. Just to name three, or it's involved in the expression of certain receptors that affect serotonin activity. That's why there's a lot of brain-related symptoms when we're undermethylated, or can be. Undermethylation is involved in the breakdown of histamine and involved in detoxification. Methylation also impacts the expression of other genes. So if we are undermethylated, we can have relatively low methyl, and many people who are undermethylated also have relatively high folate, which is what affects the low serotonin activity. In children, undermethylation can manifest itself in many ways, but when I meet a child who has been described as oppositional defiant, which is an unfortunate label that I tend to think of more as a less obvious form of anxiety, but nonetheless, these are children who can be very argumentative and sort of pushing buttons and looking for conflict. And overwhelmingly, these children are found to have undermethylation. Children that are highly competitive and strong-willed, again, are usually undermethylated. Most children, I believe it's about 94%, who are on the autism spectrum are undermethylated. Symptoms of nail biting, skin picking, and other obsessive compulsive or addictive tendencies can point to undermethylation. Perfectionism, all or none thinking, being justice-focused can point to undermethylation. Phobias can also point to undermethylation, and inattention, hyperactivity, and the diagnosis of ADHD, though again, that can be from other root causes. And so if I meet a child who has ADHD and maybe they're highly competitive and have some oppositional defiant tendencies, that would suggest undermethylation. But again, they can have more than one imbalance. So on to high copper. High copper is a player when it comes to brain-related symptoms because copper is involved in turning dopamine into norepinephrine. So if someone is high in copper, they could have relatively low dopamine activity and high norepinephrine, which is like adrenaline. So this could affect focus and also create activation as far as energy levels or anxiety. And so children who have high copper can have tantrums, rage, and emotional meltdowns. They can also have inattention and hyperactivity and often be diagnosed with ADHD. 68% of adults and children with the diagnosis of ADHD were found by the Walsh Research Institute to have a copper-zinc imbalance, meaning the copper is relatively high compared to the zinc. And what we used for this is a plasma zinc and a serum copper. For girls who have an onset of tantrums or rage or inattention, anxiety, or sleep disturbances around the onset of puberty, copper should be suspected, as there's a relationship between rises in estrogen and copper for women and girls who have problems regulating copper. But men and boys can also have copper-related symptoms. Next, I'll mention pyrroles. These are a metabolic waste product that leave the body through the urine. They are not so problematic in of themselves, but when they run high, as they might because of genetics or because of a physiologic or emotional stressors, there can be a depletion in zinc and B6. So whenever pyrroles are high, we find and expect a deficiency in those nutrients, B6, zinc, and actually magnesium as well. So similar to high copper, in children, pyrroles can look like temper tantrums, emotional meltdowns. And so when we see a child who has tantrums that are quite severe and more problematic than just a very minor meltdown, we would consider high copper or high pyrroles. And with high pyrroles, there can also be shyness. Individuals can be uncomfortable in new situations or with groups. There can be low stress tolerance, feeling easily overwhelmed when there's a lot of stimulation. There can also be problems with low tolerance for changes in routine. There can be sensory issues for some children, feeling bothered by tags in clothing or loud noises. A reading disorder may be present. Again, there can be inattention and hyperactivity, anxiety, and there may be skin, gastrointestinal issues, joint pain, and or frequent infections. Clumsiness can also be a common pyrrole symptom in children. And I should mention the way the low zinc and the low B6 affect neurotransmitters is that B6 is needed to make dopamine, it's needed to make serotonin, and it's needed to make GABA. So serotonin helps us with our mood, GABA helps us feel calm, and dopamine helps us with motivation and focus. So that's why there can be quite far-reaching symptoms with pyrroles. Children can also have mast cell activation, and this is an immune response where there can be a range of immune-related symptoms, usually of the skin, gastrointestinal tract, respiratory system, and or bladder, but the skin and GI symptoms are the most common. And though mast cells, which are immune cells, aren't in the brain, they do communicate with inflammatory cells in the brain. So when they're being easily activated, they can cause secondary brain symptoms. And the reason mast cells can be especially active can be because of a genetic vulnerability, but more often what I see is mold toxicity underlying that. So children that have mast cell activation can have just out of the blue behavioral changes and be very easily triggered. It may be by something they've eaten. It may be by stress. It may be by even some children, even weather changes can be triggering. And again, there can often be skin or gastrointestinal symptoms. Many of these children also have a degree of hypermobility, and I explain this relationship between mast cell activation and joint hypermobility, so being able to hyperextend at least a few joints. This doesn't have to be Ehlers-Danlos. It can just be being able to hyperextend one's elbow or knee, fingers. It can be quite subtle, but there is a common relationship again between inflammatory conditions that involve mast cells and hypermobility. Another condition that is actually quite common in children is candida. And with this, the hallmark can be carb craving, which can be quite severe. There can be constipation. This can cause irritability, anxiety, inattention, hyperactivity, and many children with candida are diagnosed with ADHD. There can also be obsessive compulsive symptoms and tics. So involuntary movements of the usually face and head and neck, or vocal tics, so making involuntary sounds. Another symptom can be drunken laughter and being inappropriately silly. Sometimes children actually can be quite funny that are struggling with this, and it does have developmental impacts, but some of that giddiness can be overlooked when it's actually a significant symptom. Mold toxicity is often even underlying candida and can also cause pyrroles to go up, as can candida. And mold toxicity and candida can both contribute to copper-zinc imbalances. So a lot of these things, again, can be co-occurring. Mold toxicity in children can look like inattention, hyperactivity, and again, a diagnosis of ADHD. Mold toxicity can look like anxiety, obsessive compulsive symptoms, and again, motor or vocal tics. There are often ear infections and asthma present. Those can be signs that someone has mold toxicity. There can be growth delays. Many children that are diagnosed with PANS and PANDAS, so this is pediatric acute onset neuropsychiatric syndrome, or PANDAS is pediatric acute onset neuropsychiatric disorders associated with streptococcus. These conditions basically are autoimmune conditions where antibodies are going after part of the brain that's causing OCD-like symptoms. And for this to happen, there needs to be a dysregulation of the immune system. And in my experience, and in many others, what is dysregulating the immune system is mold toxicity. So while there might be certain microbial things going on that are triggering this, what's underlying that is usually mold toxicity. And many with mold toxicity, again, can have mast cell activation and pyrrole disorder. In children, there can be electromagnetic hypersensitivity. Once again, this can look like inattention, hyperactivity, and they can often be diagnosed with ADHD. There can be speech delays, memory problems, and many children I've seen that have sensitivity to electromagnetic fields will experience ringing in their ears. Because electromagnetic fields can cause a decrease in melatonin and an increase in cortisol, sleep-related issues are also common. Lastly, I'll mention overmethylation. I mention it last because it's not as common in my experience. And the Walsh Research Institute is actually finding we have more and more people with undermethylation and fewer people with overmethylation. With overmethylation, again, this is a biochemical imbalance, somewhat opposite of undermethylation, in which we have excessive amounts of methyl and a deficiency in folate. And this can result in hyperactivity, high neurotransmitter activity. So there could be excessive talking, high anxiety, and there can be actually worsening of symptoms in children when they're put on ADHD medicines or antidepressants, because again, those are raising neurotransmitter activity, and these children already have high neurotransmitter activity. Food sensitivities can be present and result in a range of symptoms. However, one or more of the imbalances that I've mentioned are usually present and underlying those food sensitivities. For example, if a child has low zinc, they can have more gut permeability, more immune dysregulation, and be more prone to food sensitivities. If a child has candida or mold colonization in their gastrointestinal tract, this could also create gut permeability, as could mast cell activation. As with adults, when I'm doing an assessment, I use symptoms and traits in combination with lab testing to evaluate for these conditions. And as with adults, I can usually predict the conditions, as could anyone if they closely followed what the symptoms and traits are. Usually things can be predicted even before testing. Methylation and copper zinc imbalances can be tested in children starting at the age of 4. Testing for candida and mold can be done at any age. I look closely at symptoms and triggers for mast cell activation and electromagnetic hypersensitivity, though I don't use lab testing to presumptively treat those. As far as treatment, the treatment of methylation imbalances, copper overload or copper zinc imbalances, and pyrrole disorder involve a protocol of several nutrients depending on the imbalances that are present. Supplements or nutrients can be put in liquids or small amounts of food for children who cannot swallow pills. Other options is to compound them into a liquid suspension. As with adults, candida is treated with dietary changes, the focus here being on removing sugar and lowering carbohydrates. Usually children don't have to go as low as adults tend to need to with the carbohydrates, but still lower than what is the typical Western diet, and again, removal of sugar. And along with dietary changes, we use antifungal treatment. Mold toxicity involves binders to remove mold toxins. Most children do not need antifungals for mold colonization, though many who have mold toxicity do have candida. And so they may need antifungals there. And again, most children don't need antifungals for mold colonization. Some children do. For mast cell activation, several supplements can be used to help lower immune reactivity in combination with strategies to promote calming, including programs such as Stephen Porges' Safe and Sound, or using vagal nerve approaches, including products such as Apollo Neuro. Dietary changes can be easier for younger children than for teens. Some children, especially those with candida who need to avoid sugar, may need to bring their own treats to school or to other activities. Because children don't tend to have as much toxicity, microbial colonization, and hormonal impacts, their treatment is usually more straightforward. As Dr. Walsh has long said, and Dr. Walsh is of the Walsh Research Institute, whose data of 30,000 people with brain symptoms identified undermethylation, overmethylation, pyrrole disorder, and copper-zinc imbalances. Dr. Walsh has long said, and many of us would agree, that tantrums in young boys are one of the easiest symptoms to treat. They almost always will have high copper and or high pyrroles. And those imbalances are not difficult to address using nutrient protocols. Treating children can be especially satisfying because it has the potential to change the course of their lives. I'm endlessly grateful personally to the specialist who helped me help my daughter when she was young. Thank you for listening. If you'd like to help me get this information out into the world and you know someone who you think can benefit, please consider sharing. If you'd like to receive these episodes and newsletters in your mailbox each week, please consider subscribing at CourtneySnyderMD.com. I look forward to connecting with you in the next episode. Until then, take care.